We're just waiting one more minute for everyone to join, and we're going to get started. No, you're not. You're not too early. Okay, so hello to everyone that um, attending our online webinar for weight loss surgery in Mexico information. And I like to take opportunity. I have Dr. Louisiana Valenzuela with me. Of course, she is in Mexico and I'm in US. We are doing this remotely. The subject of our webinar today is collision of two pandemics, COVID-19 and obesity. And that Superman is Mexico Bariatric Center, is MBC trying to save patients from COVID-19. Just to start, we do have a drawing at the end, a raffle drawing for one person to get the surgery for free. And to be eligible for that, you guys need to fill out a health questionnaire. And if you have done that already, you don't need to worry. But if you haven't, please fill that out and select Dr. Louisiana Valenzuela as the surgeon of your choice. If you have previously submitted that, you just need to tell us. We would switch you and we would have Dr. Louisiana to be your surgeon. My name is Ron Elli. I'm the CEO and founder of Mexico Bariatric Center, for short MBC. And again, we have pleasure to have Dr. Louisiana Valenzuela, our top surgeon, chief surgeon in Mexico. So basically, this is a unique opportunity for you to take advantage of the discounted weight loss surgery. Just follow the link, mexicobariatriccenter.com/health questionnaire. Select Dr. Louisiana. And you need to watch the webinar all the way to the end. At the end is when we do the drawing and do the raffle. Basically, the topics we're gonna cover today is obesity as a global epidemic, and obesity and underlying medical conditions. We're talking about COVID-19 risk factors and how you qualify for weight loss surgery. And Mexico Bariatric Center, we would talk about what services we offer and what surgery options we offer. Dr. Louisiana Valenzuela is going to be talking about that section of the presentation, and we would open up for question and answers at the end and when we do the raffle. So basically, just quickly go over the concept of body mass index. I'm sure you all know about BMI. Basically, it's just a formula that you plug in your weight and height, and it will give you a number. As you see in this chart, that if you follow your height on the left and your weight on the right, you see that you're in the range of yellow, which is normal. And if you are in the more orange, you are starting to be overweight, and after that, obese, and after that, morbidly obese. And basically, they selected numbers like, okay, so 25, beyond 25 is overweight, and above 30 is obese, and after 40 is morbidly obese. As we said, obesity and COVID-19 has collided. So two pandemic. We were, we were always talking about global epidemic for obesity. Now that this virus has hit us, there is overwhelming evidence that first, obesity impairs our immunological response, which means it would impair our um, immune system the same way that coronavirus does. And that's why the two together are deadly. There is again evidence that the, the, the obese patients catch the virus and they get sick more, and the death rate is also higher for obese patients with COVID-19. On top of that, the cure for it, the patients who have high BMI and considered obese, they don't respond to the medication and possibly the vaccination. Basically, when you talk about obesity, as you see in this picture, your fat cells changes and become inflamed. The structure changes. And once you get to be obese, your body is insensitive to insulin. That's why you get diabetes type 2. You see diabetes type 2 often in patients with BMI of more than 30. And you also become insensitive to leptin, which is responsible, that's a hormone responsible for your satiety, which means you feel that you have had enough food. So you eat food and your body still thinks that you haven't had enough. And also you become insensitive to vaccination, like for vaccination for COVID-19. So these are all the structure of the fat cells that changes in the obese body. You know, we have always talked about underlying medical conditions, the pre-diabetes, diabetic type 2, high cholesterol, high blood pressure, cardiovascular disease, stroke, sleep apnea, fertility problems, and on and on, arthritis, certain type of cancers. And now the COVID-19, this virus has added to the risk factors for obese people. So what is the cure for obesity? Data has shown over and over that diet and exercise and medication is not a long-term proven solution for obesity. But bariatrics, which is weight loss surgery, is a quick, fast, and safe and long-term solution. So that means you lose weight fast and you keep it up. I'd like to go over this demonstration here, which shows what bariatrics does. So if a person is at 250 pounds and their brain and their body, their hormones, they're all used to that weight. And of course, you know, it depends on how long you've been at that weight. Your body is used to that weight, the 250. Your brain sees you at 250 thermostat. If you do diet and extensive exercise, and you manage to go down to 175 pounds. What happens is your body still is used to that 250, so it's going to make you more hungry and it's going to reduce your metabolism because it thinks that you're in you are not getting food, so it wants to reserve and preserve what you have. So therefore, it makes you eat more and it doesn't burn the storage, the fat storage that you have. If you perform the weight loss surgery within hours, your brain, when you wake up, your brain sees you at 175 pounds. Therefore, it makes you not want to eat and it would wants to burn the extra fat. So your metabolism goes up and your hunger goes down. Is true also for all the comorbidities. They have found that around 72 hours after surgery, your insulin resistance starts to change. So if you have been with diabetes type 2 less than 10 years, for example, your body starts to see a change right after surgery, like 72 hours. Same thing with your weight. So you start losing weight the minute you wake up, and all the problems with your blood pressure, your insulin resistance, your diabetes type 2, they all reverse. Of course, you know, Dr. Louisiana Valenzuela is going to talk about what does gastric sleeve do, but really is not so much the restriction of how little you can eat and portion control after gastric sleeve, is more for the hormone changes that you see after the weight loss surgery. Your hunger hormones go down. Again, you become more sensitive to leptin, which you were not, and that helps you lose weight fast. Of course, this data that I have in this chart is, I think it's about, yeah, it was November 6th when we updated it. So on the left side, you see how many people worldwide has COVID-19 and how many deaths we have. 560,000 at that time, I'm sure is much more now. But if you compare that with obesity, which is all the way to the right, you see that the numbers are much more as far as obesity and the deaths from obesity per year is. So we still looking at 2.8 million a year dying from obesity, and we still not past 1 million for COVID. So obesity still is a main concern worldwide. Again, the data shows that people who are at higher BMI are more likely to catch this virus, they're more likely to be hospitalized, and they're more likely to die. This pie chart shows that from all the people who were hospitalized with COVID-19, 38% were obese, 27% was overweight, and 35% was just normal weight. As you see, obesity is a major factor for COVID-19. So, as we all know, as of today, we just heard that Pfizer vaccine was approved, was authorized for emergency use in US. Of course, UK started using it about a few days ago, and Canada just approved it. So, so we're still in a crisis. The numbers, at least in US, are climbing really fast. And what they are saying, if this vaccine works, we would still have a long way to go. We're still going to be doing social distancing. We're still going to have to wear a mask until 2021. And so this virus is not, the crisis is not over. And especially if your BMI is high, you have to look at getting this weight loss surgery to cure your obesity and very seriously. And they all ask us, well, what's a good time? The good time is today. Um, we have been doing surgery successfully uh, with despite the COVID, and we still open. So I would say that you need to act today to get over your vulnerability for viruses such as COVID. And if any other virus comes after this, you're prepared. Um, so basically, a lot of the insurance companies don't cover for obesity surgery because it's such a high cost surgery. And if you have to pay from pocket, it's it's over $20,000 for gastric sleeve alone. So if you are also, even if some of the insurance companies, when they cover that, their deductible is more than what they pay us for the all-inclusive package. So basically, medical tourism in Mexico is becoming a viable option for people who are underinsured or uninsured, and they can pay relatively easily to go there and get a VIP treatment in Mexico with which we call medical tourism. So this is where Mexico Bariatric Center comes to rescue. Um, we are leader in our space, in our industry. We have performed altogether over 12,500 bariatric surgeries, 6 team of bariatric surgeons, qualified surgeons, and myself, I've been more than 10 years in the medical tourism industry. One thing that makes us very attractive is that our process is very simple. It's 1, 2, 3. Basically, you fill out the health questionnaire online and you get your approval within 48 hours. Then you're ready to pay your deposit to secure your surgery spot, and you get your travel arrangement, whether you fly or drive, and basically finish your paperwork. Our nutritionist contact you. We get you on pre-op diet, and you're ready to go. Everything is happening with online, of course, and our packages are all inclusive. Like I said, it covers your hotel night, hospital night, pre-op, post-op test, medication, hospital fees, nutrition support, and aftercare support, and of course transportation. We have a group of more than 6,000 patients that are constantly interacting on Facebook. And so the first stage is basically whether you fly or drive to San Diego. Our driver is going to be there to pick you up. We have 2 teams of drivers, professional, they treat you VIP. We are working in a dedicated bariatric surgery center, and They use state-of-the-art technology. Of course, after the COVID, we have had our own protocols to make sure the patients are handled right. And we use Hyatt Place Hotel in Tijuana right now. It's a top of the line. They are doing all the protocols again to deal with the COVID-19. For example, they don't um, book a room after 36 hours was occupied last. So they make sure they're sterilizing everything. When you go in and out, they all have their protocols that they check you. Basically, on the surgery day, you get picked up from the hotel and or we're transporting you to the hospital. You stay in the hospital 2 or 3 nights based on what type of surgery you're getting done. We do all the tests, and once you're done, we're going to take you back to San Diego so you can fly back or drive back home. Again, we have exclusive network of the best bariatric surgeons in Mexico. And currently we are operating in Tijuana as well as Guadalajara, but our main operation is in Tijuana. One of the reasons that we have low complications and high patient success is we are limiting our surgeries per surgeon per day to maximum of 4. And we are working in a bariatric center who is experienced and dedicated just to bariatrics. So they know how to handle bariatric patients. They know how to do the sterilization for this type of surgery. And they are the best in business. Again, for people who are joining later, fill out the health questionnaire if you haven't done it, and Dr. Louisiana should be the surgeon of your choice. Okay, so we get to the portion that I'm gonna introduce Dr. Louisiana Valenzuela. She's our chief surgeon, and she's been working with us since 2012. She's one of the most experienced, most dedicated surgeon you can find for bariatrics. She has actually had gastric sleeve surgery with us herself, so she knows what the patients go through when they are selecting to go through the operation. She's not only a general surgeon certified, she's also a bariatric and metabolic surgeon certified, which is one of the very few in Mexico. And easily, she has performed over 4,500 surgeries so far. And she performs gastric sleeve, bypass, mini bypass, all sort of revision surgeries. So I'm gonna let her take over and introduce herself, and we go from there. Thank you, Dr. Louisiana. Please take over.
You can hear me?
Yes.
Okay, good. Well, nice to meet you, everyone. I am Dr. Valenzuela. I'm surgeon, bariatric surgeon certified, and I have been working in Mexico Bariatric Center since 10 years, more or less, 10 years. And well, I did my medical school in Mexico, in the border to Calexico, California, in Mexicali. And I did my specialty in general surgery in Guadalajara. And I came to Tijuana in 2009 and to perform my specialty in bariatrics here. And I've been here since that date. I am very happy to choose this kind of surgery because it's very grateful to see all the patients how improve your lives, their lives, and I am actually a patient too because I had the surgery 4 years ago. I am very happy to got the opportunity to be healthy again. And well, I can share with you my own experience in and out of the surgical room because I know what happened in all aspects, like surgeon and like patient. So can I turn the slide by myself, or you will help me with that?
I have to help you with that. Yes.
Oh, good. Okay, I will try to explain to you the different option in the bariatric surgery and what is the maybe the best option for, or try to give you an idea to what kind of surgery is the best option for you. In the first place, we have the gastric sleeve surgery, who is the most popular surgery now in all world. In the past, the bypass, it was the most popular, but now it's the most popular is gastric sleeve. And why is the most popular? Maybe because it's a little less risk, a little more easier to the surgeons, technically speaking, and to the patient is more comfortable about how you are eating, how are you getting your normal life again, because this surgery needs to be under a regimen of vitamin and protein just the first 2 years. And of course, you can continue, you will continue checking your vitamins and protein to see if you need more time or not, but more or less is the time where you need to be under strictly regimen in vitamin and protein until you get from the food all this vitamin and protein. And by other side, the bypass is that one surgery to need to be under vitamin and protein all the time. So this is now it's another good thing in the sleep. It's in my experience, I did this surgery with 5 incisions many years, but because year by year we are improving in all this recovery time and all this with all this experience. Right now, I am doing this surgery in a lot of cases with just 3 incisions. So it's faster recovery. And actually, I am starting to don't use a drain in special cases. So the patients are without pain, without nausea, and in the most of the cases, because the drain is a very uncomfortable thing. But it's necessary in some cases. But if I don't use a drain, the patients are becoming to be with a very fast recovery, walking, 2 or 3 hours after surgery without pain, without nausea, and well, they are with a very good recovery time with a sleeve surgery. We take off 80% of the stomach in this surgery. We need to be sure, like you can see in the photo, the tube be opened with no narrow zones, with no obstruction tube, good tube, enough to eat every food you needed, to the tube, do the good function at the end, and not had any complication, because if we have any narrow zone of obstruction, we could be in a complication with the sleeve. So we know it's very strictly technique for this surgery to us to perform enough tight, but not too tight. So we cut that 80%, like Ron says, it's an hormone resection too, because the hormone have a very important function in the hungry. We cut that part of the stomach, and you will have the result, like the hungry become to be low. And of course, another another signal to the brain exists, but this is a very important signal to avoid the hungry. Well, this in the first 6 months, 8 months, you will have a very very important restriction to the food. So you will lose a lot of weight in that first month, and month by month you will have a little more relaxed sleep, a little more stretched sleep to permit at the end eat medium to small count of food, but enough to be healthy and with enough count of vitamin and protein. So you can give me the next one. Yeah, okay. Well, yes, we are losing maybe more, a little more. 80% of your excessive weight is our goal. 80 to 85. Some patients lose all the overweight. We are talking about your extra weight, not all your weight, just the extra weight. We have a BMI measure to know what is your ideal weight about your height. So the 24.9 is the normal BMI. Actually 25.1, it's overweight until 30, and 30 to over, it's obesity. So we are talking about 80-85% of excess of weight loss with these surgeries. So that is excellent results of the surgery. And we have here a table who show more or less how much you will eat in calories, and you will lose, like I said, in the first month is very important. The restriction is very important. The lose weight, but at the year and a half, you will see, and you will have the opportunity to eat a little more, but not too much to recover the weight loss. So it's just to normalize your weight and maintain that weight loss long term with a healthy food. So Give me the next, please. Ron?
It looks like
Hello.
it doesn't have the explanation,
Ron?
just has the graph.
Give me the next, please.
Okay. You can explain the bypass from here. Just the graph is there. You see it?
Okay, I can see it. Okay, the bypass, it's a malabsorptive surgery. This is the gold standard to bariatrics. A lot of patients choose this surgery because it's a little more long-term weight loss maintains. In the first year, you will lose the same with the gastric bypass and the sleeve. But the gastric bypass have and show better results, long-term weight loss maintains, and it's because it's malabsorptive plus restrictive surgery. And another thing is this surgery, it's a better portion of resolution in diabetes, hypertension, and dyslipidemics. So is the gold standard for that kind of comorbidities. So that patients, it's the best option for the patients who had this condition, this previous condition. It's a little more, it's 1 point more maybe in a risk to get the common complications like bleeding, obstructions, and another kind of complication, maybe infection in the wounds. But it's not too much than the sleeve. It's almost the same. The sleeve is more or less 0.3 to 0.7, and the surgery is until 1.5 maybe, that kind of complication. So basically we do a mini pouch of the stomach, like you can see over here, and we do an anastomosis with a small bowel. The food goes directly to the small bowel and jump and avoid all the intestine you can see in light blue. So it goes directly to the down in the small bowel, and that promote to have, of course, less absorption of the fat, of the sugars, and of course the vitamins and the proteins too. So it's because I explained you need to be under constantly ingest of the vitamins and protein all your life after this surgery. And of course, it's a little more work with the doctors to check in your levels of vitamins, proteins, and if you have any deficiencies to correct that deficiency. And it's the reason you need to be in touch with your physician to do this kind of lab test to check year by year. In a sleeve and in gastric bypass, depends. If you are okay and you continue be good year by year, you can do the test. If you are with a deficit of B12 or biotin, you need to check every 6 months. And we will give you all these, of course, all these needed and how frequently you need to do this test with your doctor. Can you give me the other one, Ron?
Yeah, you should have it. Do you see?
Please.
I think it takes a lot of time when I change it for you to see. It should have it.
Okay, well, the other option in the surgery is a revision. Sorry, I have a bad connection.
Yeah, we can hear you now. You just got interrupted for 1 second, but we can hear you now. Do you hear me?
Yeah.
Okay, go ahead.
Mm-hmm. Okay, I was explaining about the bypass and I thought, yeah. Okay, I don't know, you have any slide to explain the mini bypass on another surgery?
No, but I can bring it up just a moment if you want. So what?
Okay, this slide is how is the mini bypass is a version from bypass. The bypass, we do one anastomosis up between the stomach and the small bowel and another one down between the bilis and the foot down. But in the mini bypass, we jump just a lot of small bowel and the foot come down at the same time with the bilis. Now in the bariatric world, we have more or less 6, 8 to 7 years doing this surgery who named mini bypass, but reality it's bypass, one anastomosis bypass is the good one name for that surgery because it's a bypass and it's a very important the function of this surgery. It's the same as the bypass. It's resolving the diabetes, it's resolving the high pressure, and it's given actually a little more weight loss, the bypass. Just have one condition who it could be the bilious reflux, but it's a very low rate. It's around 3 to 5% max, but it's more relation with the technique. So sometimes it's more the maybe the technique to have this reflux of bilis than the surgery by itself. But it's a very good option in some cases when the patients have a less risk surgery, and sometimes we need to take the decision, depends the BMI, depends the risk of the patients, because this is a faster surgery than bypass, a little more, maybe half an hour or less than bypass, because it's just one anastomosis. And in a special condition, like the patient is a very labile for the anesthesia, or they have a cardiac issues, we offer this surgery instead by full bypass to be less time, less surgical time, and less risk of complications, because in the bypass we have a little more chance to get two sites of obstructions, two sites of bleeding. In this case, it's just one. So this is a very good option too. And we need to evaluate every one patient to choose at the end the best one option for everyone. It depends on BMI, depends if you have or not previous conditions like cardiac, maybe you had a bleeding blood, you are a thinner blood because you had a previous condition, or you have a clot condition too. So it depends. If you have diabetes, if you don't have diabetes, all need to be evaluated to choose the best option to choose the surgery at the end. Another thing I didn't say is the stay, hospital stay. In case of the sleep, is just 2 nights. In the bypass or mini bypass is 3 nights. So we are evaluating in bypass, you will have a very good way of the food with not obstruction, and you are tolerating liquids with any problems to leave from the hospital. So it's the reason to get the patients 3 nights, because at 2 days, the most of the patients are perfect, but we need to be sure you don't have any obstruction. So that extra night in the hospital give us the security you will be fine with any complication at the end. Okay, could be the next.
It's done.
Okay.
So we'll go in.
Well, the other kind of surgeries is a revision surgery. So right now we have a lot of patients who come to get a revision, a sleeve to bypass, to mini bypass, lap band to bypass, lap band to sleeve, actually bypass to bypass, mini bypass to bypass. It's a very lot of revisions we have right now, and it's a result of the maybe don't be in a mentality to change the habits with the surgery, because you need to know this is a tool, and it's a very good tool who works perfectly, but at the end it's just the tool to change your habits and improve all the healthy life and healthy diet you need to have. At the end, even if you have a duodenal switch or any very aggressive surgery in your body, if you don't change your hypercalorie ingest, you will regain weight. It's impossible to say this is a magic forever. No, this is a magic to rehab your healthy life again, but it's your work to maintain that weight loss forever. So you need to be in conscience. It's getting the opportunity to come back to the healthy habits and maintain that healthy habits to maintain your weight loss and your healthy body. forever, because it's important to the patients know that it's not just the surgery, it's change your habits too. Of course, this tool help to don't do wrong things in the first years, but at the end you need to change your mind to be in a healthy habits, healthy diet. This duodenal switch surgery is the most aggressive surgeries in the bariatric surgeries. It's for patients who had diabetes.
All the pages are.
Diabetes. So it's a good surgery, but needs to be in a very, very strictly follow up after this surgery. It's very important you be under strictly follow up with your doctor, with your bariatric work doctor, because it's very common the deficiency vitamins and protein with this surgery. So you need to be sure you are getting enough protein and vitamins, and the strictly control with your doctor about that. So it's for a patients who know are disciplined patients to follow up this strictly routine to check your vitamins and your protein levels, because the food come to the small bowel very down. It's very malabsorptive surgery, so it's a good option for a disciplined patients and disciplined strictly follow up with your doctor.
Okay, so what is the next slide you want? Just, okay, we're gonna go back here. And there you go.
I don't know, maybe the measures to be safe right now in this pandemic COVID situation, we are getting just the patient in the room with not company to avoid the possibility to get infections, and we are getting our own mask in the surgical room to avoid the possibility to contaminate the patient. And of course, the patients need to be under tomography lab test to evaluate they are without infection before they come to the hospital, who is very important to us and to the other patients, to don't put on risk the other patients too. So all the patients who go into the hospital, we are sure they are free from COVID. So we are taking all our measures to the patients be saved, and of course our team will be safe to continue doing the surgeries, because it's important the patients know it's not just the patients who need to be free of the infection. The hospital staff need to be free of infection too. So we are taking all the measures to be sure we are not putting on risk our patients. And actually we are having a very good results with our measures, because I didn't know any patients who called to say they are infected because they came with us. So we are doing the good job with that. and we will continue with this in a long time until we be sure we are safety from this virus. Okay, so you can see in the monitor what is the measures we are taking to everyone here.
So basically, when we send information for preparation for surgery, we would mention all the measures that they need to do. Of course, a lot of it everyone knows, you know, when you're traveling, make sure you wear mask all the time. You know, using sanitizers, and actually, um, it's new data that came out. Probably everyone knows. I'm just going over to make sure that that the plane cabin is one of the safest place you can be, because of the HEPA filters that they use and the spraying that they do in the um, plane. So so that part it was a concern for a while, and now at least there are some assurance that the plane itself is not a place to catch the virus. Just as long as you know take the precautions when you're traveling. Of course, once you're in San Diego, from there we do all the precautions ourselves, you know, and we do all the right measures, so you be as safe as possible. But this instruction would be all in your consent form. Um, as far as financing, we work with a couple of companies like e-financing and United Medical Credit. Of course, you may want to also look into companies like SoFi, Lending Tree, Lightstream. These are all also options. The only caveat is please do not apply to a bunch of them at one time. Maybe one or two and then wait, because once you apply to a bunch of these, it affects your credit score. Okay, I guess I need to yep. Okay, so we are at the point that we're going to open up for question and answers, and I'm going to go over one at a time. The ones it's related to the travel and medical tourism, I'll be answering, and the ones that are medical, Dr. Louisiana Valenzuela would be answering. The first one says, can I take Dramamine for nausea on the trip into MBC the day before surgery?
Yes, and it's important. That question is very important because some patients think they won't have the opportunity to take any kind of pill after surgery. I know this is before, you are asking before, and the answer is yes, but the important is you don't take any blood thinner pill before the surgery. In special cases, when the patients are taking blood thinners for any reason, we will give you special indications for that patients. They send the health questionnaire. We took recommendations for that patients, and special patients. But after surgery, you will be able to take any kind of pill, like any ibuprofen, because it's a myth. The patients can take any pill. So you will be free to take any kind of pill, thyroid pill, and anti-inflammatory, any antibiotic, and so it's fine if you take Dramamine for the travel. It's not contraindicate. After the surgery, we will give you some pills to take, include blood thinners, painkillers, antibiotic, antispasmodic medications, and some gel, antacid gel, and antacid pills too. So it's the answer is yes for these questions.
And also, how about metformin?
Metformin, if you are taking metformin before surgery, just the day of the surgery, you don't take that medication. Days before of the surgery, you will doing a pre-op diet. The last 2 days before you come, you will be under a just liquid diet. So it's important you monitor your glucose to don't have any low glucose if you are taking any diabetic pills like metformin or insulin or another kind of medications and diabetes. And that is measure in every patient is different, so we will to be care in single measures in everyone who had this condition. So you will send to me if you are taking that pill, and I will recommend how you need to take the pill, and depends how much doses you are having. So in case you like this question is pre-diabetic and with metformin, 1 day is enough before the surgery to stop that medication because you are in low calories diet, and then most probably you won't have a high glucose. So stop the metformin 1 day before the surgery, and we will control your glucose here. So you won't need to continue take that pills until we recommend it again here. It's important you know you will not be alone in this. We will give you all instructions. Depends if you are taking thyroid pills, metformin, on another pill to pressure or another condition you have. We will give you all indications since you be here, and all recommendations when you come to home to go again with your doctor to change the doses with your doctors, and all you need to know about your medication. So don't feel you are alone in this. You will have all our recommendations all the time. We work with an internist who is supporting us to recommend the best way to change or stop or start the medications you was taking before you come, and when you need to stop, when you need to start.
Okay, awesome.
You hear me, Ron?
Yes, I do.
Mhm.
They're asking, how does this surgery affect pregnancy? Is that going to affect losing baby or postpartum, etc.? Did you hear me?
Well, we have a strictly time to don't be pregnant. 1 year. Yes, I can hear you.
Yeah, but I think
You can hear me?
yes, we hear you.
Okay.
So so
We
also
uh-huh.
I think as far as we see, all the patients with PCOS, um, more than 50% are
Resolve.
better after surgery.
Mm-hmm.
So gastric sleeve is a solution for PCOS, and a lot of patients that they were not able to get pregnant, they can get pregnant
Yeah.
after surgery. But
That
like you said, you have to give it time, right?
Yeah, and actually about that, it's important the patients who can't be pregnant before surgery, they be sure to be under birth control, because we had a lot surprises immediately after got the surgery. They got to be pregnant. So 1 month after surgery, 2 months after surgery, they are asking me what need to do because I am pregnant and I just 2 months after surgery. So it's important you be sure you have a very good birth control 1 year after surgery, because this change is actually very fast and resolve the syndrome very fast, and the patients can know they improve in this and they are getting pregnant immediately. So you need to be sure you are taking the good one, birth control, to don't be pregnant in the next 1 year, because it's when you are losing all the weight, and of course the vitamins and protein are down too, and it's important you give the opportunity to the body recovery from this weight loss, fast weight loss, to be in a good level of protein and vitamins to give to your baby after the surgery. We don't have any bad uh, uh, experience with patients who had who be pregnant after surgery. The babies are perfect. Any problem in the weight or in their proteins or approaching in their growing up. So don't worry about that. Just need to be sure 1 year after surgery, don't be pregnant.
Okay, so they're asking, what are the follow-up visits like, and what information do we need to provide to our local doctor?
Okay, we will give you a summary from your surgery, our recommendations. We will give you a list of possible complications to could have in case you have different symptoms after you leave from here. In case you leave from here very, very good, and you have a different situation at home, when you need to be to ER, or what is wrong, what is good, what is normal, what is expect after surgery. And all our recommendations will be in a discharge papers with your summary from the surgery, from your medications you got in your health study, in the hospital health study, and in case you need to be in touch with your doctor and a special report, we can do it. So don't worry. We have actually I have all the videos for every one of the patients here, so I can come back to the videos to see if you need to extra or in a specific summary. I can come back to the video to see how was your surgery and say the surgery was perfect, don't have any situation or special situation in your case. And at the end, we send videos to some doctors who they have a special questions or special request to show the surgery was good with any problem to be easier about the surgery. This is a special occasions and it's directly with your doctor, and we can do that for you in case the doctor had any special request to be easier about the surgery was good.
Another patient is asking that they are going to need a hernia repair, hiatal hernia repair. Mm-hmm. Do they need an extra incision or drain for that?
Well, no, it's the same incisions. Actually, I was talking about I am doing 3 incisions when the patients have a small liver and when the patients did a very good pre-op diet, the liver come to be shrinking, and that helped a lot in surgery. So a lot of patients do a very good pre-op diet, and that result in 3 incisions because we don't need the extra incision to the liver retractor. But in case the most common is 4 incision because most of the patients have a large liver, and it's not changed to me to repair hiatal hernia. It's the same 4 incisions for the hiatal hernia with or without drain. It's the same.
Okay, so they're asking, how do we select the best surgeon for each situation for each patient? So we talked about why Mexico Bariatric Center is one of the top providers of weight loss surgery in Mexico. One of the pieces that we have is our surgeon liaison. And she is the one that monitors the traffic for the health questionnaires to go to the surgeon who fits best for each patient. So Jennifer is actually working every day around the clock to make sure all the health questionnaires are handled the best way. So each patient is matched with the best option for the surgeon. Is there a problem if somebody has had C-section before?
No. The most of the patients, big percent had babies with a C-section, and it's because it's down and it's not in our work area. It's not important to us. It's very rare the C-sections give us scar tissue in our way where we work in the bariatrics. So very, very rare we have a scar tissue from a C-section.
Another patient is talking about hiatal hernia again. They're saying the flap that closes the esophagus is not working properly and they're getting GERD. Is that going, can this be fixed during the surgery?
Well, this case is important to talk and explain the previous surgeries in acid reflux, like in this case is an fund duplication, need to be dismantling to cut the stomach, and that could result and you still have acid reflux. So the best option for this kind of patients who had in the past a flap, the fund duplication in your esophagus, and it's not working, is definitely the bypass. The bypass is an anti-reflux surgery, is close to zero the possibility to have still acid reflux with this kind of surgery. And by other side, if you try to do a sleeve with patients who had this problem and actually the previous surgery don't works, it's very high the risk to continue with the problem and increase the problem with the sleep. So you need to get the option to bypass, because if not, it will be again the problem with the acid reflux with you.
Patient is asking, can I sleep on my belly after surgery?
Can I what?
Sleep on their belly.
Oh, like single incision?
No. Can they sleep on their face down on their belly after?
Oh, yes. Yeah, actually, the first day after surgery, you will be able to wake, stand up and sit and walk and do the most of the things you do by yourself, sleeping at sides. And of course, in the first days, if you come to sleep over your stomach, over your tummy, you will have pressure, bad pressure, and you will feel discomfort. But in 1.5 weeks, you will be able to sleep at any position you want.
They're saying if I use CPAP for sleep apnea, I'm not sure if the current pressure may need to be adjusted. Should I have another titration? Is that called titration study done prior to the surgery?
No, if you already use CPAP, you just need to bring your CPAP and use your CPAP like you regular do. It's actually a very good when the patients already are coordinated with their CPAP, because that is security for us. They are breathing normally after surgery, and our recommendation all the time is they continue using like they used to be using the CPAP.
You may want to talk about recovery after surgery, like what activities they can do, when can they start doing heavy lifting exercises or heavy lifting, intensive workout. What is the time frame?
Okay, and the first week after surgery is where you need to be careful to don't walk a lot, but you need to walk constantly. Every 2 or 3 hours, do a lightly walking around your home, around your block, slowly, but continuously doing that, continuously moving your legs, and where you are stand up, the lungs open better. So our recommendation is you walking, but in very low impact. After this week, you will increase a little more that walking impact, a little highest. And the lifting is 50 pounds in the first 6, maybe 4 weeks. After the 4 week, you can increase a little more your weight to lift. And you need to wait 6 weeks until you be in workout. 6 weeks, 1.5 months after the surgery. It's the normal time to redo all workout, run, swimming, and you will see in 1 week you will feel much better to drive, to moving a little more. Our recommendation is 10 days to come back to the work. Some patients are asking me, I am having a desk job, can I come back to the job? Yes, 1 week if you feel fine and you don't have any pain, bloating, or limit to get your food, you can come back to the desk job. But the ideal is 10 to 15 days to do a little more movement, a little more busy job. So the ideal is 10 to 15 days, but if it's very necessary, you come back in low impact job, you can come back at 7 days.
Okay, what about taking diphenhydramine for allergy before surgery? So if they have allergy, can they take the medication?
Yeah.
Before the surgery? Okay.
Yeah, actually, sometimes rare cases here, they do rash for some medications who never takes before. We put allergic medication with a problem, and they go to home with that medication. You will be able to take any kind of pills.
Yeah, so yeah, this one was diphenhydramine.
Yeah.
Okay. There is a question about revision surgery, and so there are two parts of that question. They're asking, what are the charges? So basically, when we talk about our all-inclusive packages, that does not cover any other fees, like if your BMI is more than 49, if you have had previous bariatric surgery, which is considered to be a revision now because we are converting a lap band to sleeve or sleeve to bypass or mini bypass. Those are extra fees. We also are charging at this time $100 for COVID testing, which is added to your all-inclusive package prices. As far as nutritionist, if they haven't reached out to you, which they usually do, they text you, they email you, and you can reach out to them at nutrition with email, nutrition@mexicobariatriccenter.com. So that's the email you can use to contact them. I'm just going to type that. And the other concern it is that if right now we are picking up patients from two locations, whether you fly in or you drive. We have two locations. One is the San Diego International Airport. The other one is Hampton Inn. So the patients sometimes that can't come in time because of the flight, not having the time that they come in before 8 o'clock at night, or however the arrangement is. Hampton Inn has given our patients a special rate of $119 a night plus the tax. So you can stay there and our drivers can pick you up from there. So two locations, you can either drive or fly. We pick you up from Hampton Inn, close to the airport, and and then of course the airport itself, Terminal 1 and Terminal 2. Um, as far as other hotels in the United States, other states, every state right now is operating differently based on how bad the COVID situation is. So we cannot answer like what hotel is open and what hotel is not. But as far as we're concerned, right now, this is the arrangement for San Diego. Um, they're asking if there is an issue for receiving medical services after they go back home. There are very few times that we have had uh, general doctors or physicians not want to serve you if you had surgery in Mexico. But most of the time they are supportive. And also we have a list of um, not a whole lot of states, but some states with the patients that have had success with their primary care physician. And we can share that with you. Of course, once you join as a patient to our support group on Facebook, you can pretty much ask on the group of for the area that you live, who are the primary care physicians that patients use. So you have that option too. If they have had hernia repair with the mesh, is that a problem for having the surgery done?
I already have a mesh.
Yes.
Okay. If you have the mesh in the wall, it's not a problem. If it was a hernia repair wall with the mesh, it's not a problem. We won't touch a mesh, and you will have a rehab the hernia because the surgery. It's a very tiny incisions, and we can do includes with if you have a mesh in your wall.
Another one is they're saying if they have had appendectomy, yeah,
Oh,
is that a problem?
Oh, okay. This is like I think they are saying like tummy tuck, appendectomy, or appendicectomy.
Yes. No,
appendectomy. Maybe they are talking about the tummy tuck or abdominoplasty.
Well, how about? Well, no, I think it's a removal removal of appendix. If they have had appendix removed.
Ah, okay. The appendix surgery is not. Yeah, well, it's very uncommon because it's very down and the other side of your abdomen. So just in case your case, it was a very aggressive infection, intra-abdominal infections, because your appendix could be in a result in a lot scar tissue, but because it's very down in the right side, and we work in the left side up, is very far from our area. So it's very rare we have any issue with that. It was a simple appendicectomy, then most probably we don't see any problem in any scar tissue.
Yeah, if you have had hernia problem, you know or you don't, the surgeon checks that and they repair it during the surgery. Okay, so they're asking, what is the chance of bleeding from gastric sleeve, and what if they need blood transfusion?
Okay. The percent of bleeding, it's very low. It's 0.4, 0.7. Actually, in this year, in my experience, I don't have any reintervention because of bleeding situation. It's very, very low rate. But in special cases who the patients had history, blood thinner history, and all the blood thinner who we use, they are more sensitive for that blood thinner. So it's very, very special cases. It's low to 1% of the risk to get bleeding. But in case they have, we had a very good protocol to start in the recovery immediately. Of course, we start with medications and measures before we took the decisions to give blood. The blood measure is not the last one option, but it's not the first one immediately if you start to bleeding. It depends how is the bleeding situation, and it's not a problem. The most of the cases stop with needed to re-op the patient. So you need to be no worry about that because it's a very low risk. But in case the bad lucky you have this problem, we had a very good protocol to recovery and stop the bleeding situation. So don't worry, we have a very good medications and protocol to stop the bleeding in case.
They're asking if they have blood clots running in their family history. What would you do when you do the surgery?
If it's just in your family, not on you, we will do the same like the other patients, the same measures. We are recovering the patients fast to walk, the compressive socks, the blood thinner after surgery, and continue the blood thinner for a while. It's our protocol, and it in a very good results with I can remember a clot issue with patients in at least or 3 or 4 years. So it's the same. It just was in your family. It was in you. We took to stop the blood thinner 48 hours before surgery, and we restart immediately after surgery to prevent any clot situation.
So they're asking what type of prescription medications do we need to bring with us? If they have prescription medication, should they bring it with themselves to Tijuana?
Okay, just if you are taking your own pills, the pressure pills, the pressure please, or to the high pressure pills, or the thyroid pills, you need to bring with you. And we will give you after surgery the medications you need to take. Just the anti-acid omeprazole you need to buy, and you will have the opportunity to buy here in our drugstores. And it's not a problem. It's a very easier, and our drivers help all the time the patients to get that medications with any problem. And the rest of medications we will give you the blood thinner you need to buy, but we will give you the prescription to buy here after the surgery. The drivers and the coordinators here, it will help you. It's not a big deal. It's very easier to get that kind of medications.
So they're asking, they had a band that got slipped in February and blocked the stomach, and immediately the fluid went to the legs, and their legs got so huge that was feeling that going to split open. And will this fluid come back after surgery? Nobody can explain why this fluid went to my legs. And I'm afraid that the fluid would go back to my heart and my lungs.
Okay, in this special case, we need to be sure your heart is strong enough. So I asked you cardiologist clearance in first place to check how is your heart before you come. And if the cardiologist says you are okay to get the surgery, we are very strictly with these previous events with the patients to put on a special bomb to count exactly the liquids come to your body, to don't be over paced with the liquids in your body, because that sounds like a problem. You had more liquids than you needed, and your body was stuck with that liquids a lot of time. So this is a special cases. We didn't have problems like this because we know what the patients are more liable to receive the liquids, and we are very strictly with our count of liquids to come to your body, and don't be over liquids in your body. So the first thing is to ask for the cardiologist test clearance, and if your heart is good, you can come and we will give you a special attention with your liquids with a bomb, and of course our internist, we will give you a special comments to be careful with these possibilities on you. But don't worry, it's not, if you are okay with your heart, you will be fine. It's no common issue. We have patients like you and liability of the liquid, so we can manage it, the problem.
We're asking, is lap band revision to bypass, is it common? And is the recovery extended because of the revision?
No, it's the same recovery time. It's very common because the recommendation all the time is to perform restrictive surgery to malabsorptive surgery. So yeah, it's very, very common and it's a good option.
Will the surgery affect tubal? I think they're talking about if the tubes are tight, is that going to affect if the tubes are tight?
Affect tubal, like
Yes.
I don't understand what is that
You know
tubal?
how if you don't want to get pregnant again, you
Oh, no.
tie your tubes.
Oh, no. Because it's, like I said before, it's very down your uterus and your tubes, and it's for nothing in our way to work. So it's no to be worried about that.
What type of health check should we do prior coming for sleep?
Okay, if you want to be sure you won't have a surprises here, CBC, normal CBC, the count blood test, and if you are with any issue or comorbidity like chronic diabetes or chronic hypertension or and another issue, in this time in COVID time, we had surprises in the tomography, but it's not a recommendation to perform tomography before you come. We will do here in case it's a very wrong tomography. Of course, the patients need to understand we are need to perform the surgery in the best condition possible in your body, and that includes your lungs. In case we found any bad tomography, because the tomography shows your lungs are not good to receive the anesthesia, we need to postpone the surgery. It's very rare, but could happen. We had 2 or 3 experience here, and you just need to be sure. If you want to be sure you won't have any surprise here, maybe the COVID test is a very good option to perform before you come, and a CBC, normal test, count blood test. Mm-hmm.
Yeah, we do recommend that they take just the general blood count
Mm-hmm.
test, especially if you're a revision patient,
Mm-hmm.
just to make sure. So if you are revising a lap band to sleeve or a bypass, how do you determine if it can be done in all one operation, or you need to take the band out and come back for the actual revision surgery?
They want to know.
You know, like if you have a band, you know, how do you determine if you can remove the band and do the sleeve or bypass or mini bypass, or you have to remove the band and then come back 6 months to a year later to do the sleeve or bypass? So
Okay.
it will be 2 operations instead of 1.
Okay. Well, the The best option is to remove the lap band and do the revision at the same time. If your conditions are good, if you are in a healthy, good condition, you can take in the same surgery, remove your lap band and come to have a sleeve or bypass. In my opinion, the bypass is the best option in the revisions lap band revisions, because you had these previous restriction surgery, who is the lap band, and the malabsorptive surgery, it will improve, give you a better improve in your weight loss. So some patients don't want the bypass. It's respectable. If you don't want the bypass, you can do the sleeve instead the bypass. But in bariatric world, in bariatric experience in the world, we know the best revision is to bypass in case the lap band, previous lap band. So you can have a very good improvement with the sleep, yes, but we know it's better, a little better, the bypass. So that is, at the end, it's a decision between the patient and the surgeon. It's not means the sleep don't works, but we need to give you the best answer, and you at the end get the final decision in some cases. In another cases, of course, we recommend, or because our experience, what is the best option, and we do the high recommend. In this case, you can have both options, thinking in how you want to goes your life. If you want to be under strictly follow up about your vitamins and protein with your bypass, or if you don't want that and you just want to again a restriction surgery, you can get the sleeve. So it's your decision. You know, if you are disciplined person to be in a strictly follow up in your diet and your vitamin and protein, or you decide to get just the sleeve surgery.
Okay, so believe it or not, we answered all the questions, and right now, before I continue and get to the raffle, we want to show some of the success stories. A lot of our patients not only have lost weight, they have turned into bodybuilding and they look great. One of the success stories that we have in-house is our own patient coordinator, Didi, that went to Tijuana 3 months ago, and she got surgery with Dr. Valenzuela, and she's actually going to take a few minutes to share her story with you. She's coming here. Okay, so I'm gonna let her take over and share with you. There you go.
Okay. Hi, everybody. My name's Dee Dee, and I underwent the gastric sleeve on August 24th, and I'm down 70 pounds. Woo! I'm loving it. Dr. V was my doctor. She was absolutely amazing. I highly recommend her. I had a wonderful experience. Does anybody have questions?
Or you would see the questions by going down there.
I don't think there's any.
I want to say 70 pounds in 3 months is a very, very good improvement. And congratulations, Didi.
Thank you. And Dr. V is definitely the best surgeon for the sleeve.
Thank you.
Bye, guys.
Okay, thank you. Okay, so a couple more questions came in, and yes, to be qualified for the raffle, you need to have Dr. V do your surgery. Who's the best surgeon for gastric sleeve? To be honest with you, all of our surgeons are great. Dr. V is very special. She is one of the top surgeons that you can find worldwide. So highly recommend it. Okay, so let's go forward with our raffle. Before I continue, there was a bunch of questions about recovery and vitamins. So when you go through gastric sleeve or bypass, you need to have the right diet and take supplements, especially for bypass. And we do have the best line of vitamins for bariatric patients that comes in soft chew, chewable, and drinkable. And we highly recommend that you stick with these vitamins after surgery and take with, of course, some come with calcium, but you have to take some of them without. That's something that you can find out talking to our nutritionist, what is the best option for you. But that's, we do highly recommend take Emerge Bariatrics. Okay, so they just give me a moment because they just announced who is the winner. Okay, so I hope I am not saying her name correctly. Euritzi Cardenas is the winner of our webinar. And I can let you talk. Let me find you here. I'm gonna allow you to talk. So if you have anything to share with us, please do so. Hi.
Hi.
Euritzi?
Yes,
Hi, how are you?
I'm doing good. How are you?
Okay, great. So you are the winner of the $2,000 off of our surgery. Have you, so are you ready to go? And tell more about yourself.
So I've been interested in it for quite some time now. I guess I'm kind of ready to go.
Okay.
Congratulations.
Thank you.
Okay. So basically, the next step is our coordinator will be contacting you and make the arrangement for you to book, and we wish you the best. Okay, we see you down in Mexico. Thank you so much. Okay. Okay, so pretty much that wraps up our I would say monthly bariatric informational webinar. Thank you so much for everybody to attending and spending your time with us. Love to see you down there in Mexico, and take care. Be safe. Thank you, Dr. Valenzuela. I appreciate your time. Thank you.
Thank you.
Bye-bye.
Thank you. See you.
Okay, bye.
Like 2,500.
How much is it? At 35. And then you had